It's a silent, deadly killer. The American Cancer Society estimates that about 21,000 women will be diagnosed with ovarian cancer this year, and over half, sadly, will lose their life from it. Here to help spread awareness and the risk factors is Dr. Yarini Quezada with Well Health Women's Specialty Care. Good morning to you and welcome.
Good morning.
Now, September is National Ovarian Cancer Awareness Month. Why is it so important to know that, and how hard is it to detect?
Sure. So ovarian cancer has traditionally been known as a silent killer. And the reason for this is because some of the symptoms that may occur early on in the disease process may be very vague and may mimic other disease processes. And patients may delay presenting to their physician, and by the time they do present, the disease is at its later stage.
Would it feel maybe when you say you can't tell really, it would just like your stomach hurts, or you have a cramp maybe that you think is something else?
Yes, exactly.
So women blow it off. They don't go to the doctor. They take care of their family. They have busy schedules, and they don't take care of themselves.
Exactly.
So this is so important to be aware of this, and we have some signs on the screen here. Can you tell us about this?
Yes, so some of the signs and symptoms associated with ovarian cancer can include abdominal bloating or distension, abdominal pain, changes in your bowel habits, inability to tolerate certain foods, or just feeling very full after a few bites, urinary frequency or urgency, pelvic pain, or some of the constitutional symptoms of cancer, which include fever, chills, night sweats, and unexplained weight loss.
And can you tell us the person who is the typical person that would get this? Is there such a person?
So there are genes that have been associated with ovarian cancer. BRCA1 and BRCA2 have been associated with both ovarian and breast cancer. And patients that have a mutation in BRCA1 do have a 40% lifetime risk of developing ovarian cancer by the time they're the age of 70. And patients that have BRCA2 mutations have a 10 to 12% chance of developing the disease by the time they're at the age of 70 as well.
Are there things that we can do to either prevent it or lessen the risk?
Sure. So there is strong data that suggests that oral contraceptive pills has been associated with decreasing the risk of certain types of ovarian cancer, as well as breastfeeding, and patients that have had children in the past have a slightly lower risk.
Is this a death sentence for women who get this? Or no, you can fight back and go see your doctor?
I think that most importantly, you should listen to your body. If you're having any of these symptoms, you should talk to your physician. And for females, they should always have their annual pelvic exam.
And why is that so important?
Because detection and early prevention can definitely increase your survival chances with this disease.
And what happens during an annual exam for women who've never gotten one?
Sure. So annual exam, we'll just go over your history. We'll do a physical exam. And if you have risk factors, we'll do further testing for you.
And where can women go if they have questions?
Yeah. So if they have any questions regarding anything that I've discussed here today, or if they have any general questions regarding women's health or reproductive care, they can contact us at the number provided on your TV screen right now, and either myself or any of the highly qualified physicians in our practice would be more than happy to see them.
If your grandmother has this, would you be more likely to get it as well?
There are some genetic links, but like I said, some of the gene mutations are very, very important. So if there are family members that have had ovarian cancer or even breast cancer, then yes, that is a risk factor for you.
And what about smoking? Does that
Yes, smoking
play a
is
part?
another risk factor.
And why is that?
Because smoking does alter some of the blood vessels and some of the supply to the ovarian structures. So,
And let's say you do get this. What is the treatment for it?
It all depends on what stage you are diagnosed. Obviously, if you are diagnosed earlier on in stages, your 5-year survival rate is up to 90%, whereas if you're diagnosed later on in stage 3 and 4, then that decreases to about 20% survival 5 years.
So it's so important to get checked up, go for your annual, go
Yes.
see your doctor if you have any questions.
Yes.
Thank you so much.
Thank you.
Now, stop ovarian cancer in its tracks. Well Health Women's Specialty Care has 8 locations here in the Valley. Just head to the website or call the number on your screen. Remember to follow them on Facebook and Twitter.